Hi folks, I'm Dr. Ed Beyer. Today we're going to talk about reason number 8. There should be an 8 right here. On why you are suffering from an underactive thyroid and your doctor's not finding out why. It's the number one complaint I hear from my female patients and a few males. Doctor, I don't understand. I'm on thyroid medication and I'm still fatigued. I'm still gaining weight and I don't know what's going on and my doctor isn't giving me answers. This is reason number 8, high cortisol. Cortisol is an adrenal gland hormone. It's a stress hormone. It's a very, very important hormone, but when, like any other hormone, if it's too high or too low, you're going to have problems. The health of your adrenal glands is extremely important to the health and function of your thyroid hormone, okay? Here's how your high cortisol, your high stress hormone cortisol, will shut down thyroid function. Number 1, it shuts down your pituitary gland. High cortisol will shut down your pituitary gland. Folks, this is where we make TSH, the main marker your doctor looks at. Thyroid stimulating hormone is TSH. It's not a thyroid hormone. It's a brain hormone that controls your thyroid. You will start producing less stimulation to the thyroid because this hormone will drop. TSH will drop when cortisol is high. And by the way, high cortisol will also cause brain fog and a lot of other bad things to the brain. Now, when your thyroid gland is properly stimulated, it's going to be producing mostly T4, about 93%, and then a little bit of T3, which is actually the active form of the hormone, about 7%. Now, what happens is T4 and T3 jump onto a protein, I call it a taxicab, and it gets delivered to the liver, gut, and kidney. There, the inactive T4 gets converted over to the active T3. So this happens away from the gland, as most thyroid problems occur away from the gland. And the enzyme that does this will be shut down with high cortisol. So high cortisol shuts down the pituitary gland and lowers TSH, and it shuts down the conversion of inactive T4 to active T3. The third area where high cortisol will shut down your thyroid function is high cortisol will block the ability of T3 to go into your cell and tell your cell to make proteins, which is what your thyroid hormone does, and it blocks that. So 3 ways high cortisol can shut down thyroid function. Your doctor, we look at all of these. I'm Dr. Ed Beyer. I hope that helps. We'll talk to you soon.